Why surrogacy is required? There are a lot of women out there with history of repeated IVF failures, advanced age, or patients who have undergone cancer treatment, or patients who have uterine anomalies. There are some patients who have absent uterus or who have undergone removal of uterus because of medical complication, and these are the patients who cannot carry the pregnancy for 9 months even if their gametes, the egg and the sperm, are available and they want to have a child. Now, when choosing a surrogacy, there are steps involved in surrogacy. For a lady to carry a pregnancy, the lady needs to be physically fit. So we have to do screening of a lady who is willing to act like a surrogate mother. A surrogate mother can be a relative or a non-related person. If the mother is a relative related to the intending parents, it's called an altruistic surrogacy. Non-related surrogacy comes with a legal agreement and compensation. Now, while taking up a surrogate, we have to understand how we have to recruit a surrogate. There are steps of recruitment of surrogacy. First step is screening of the surrogate mother, screening of the family, taking a legal documentation, doing a family visit, then medical fitness. Usually in our experience, we have experienced that women with a stable family, with their own child and a stable family life, maybe having a little bit financial constraints, usually opt for surrogacy. And we have got a very good experience with managing surrogacy of these ladies who take care of their pregnancies and are very comfortable in carrying the pregnancy for 9 months. When surrogate mother is to be recruited, we have to take in accordance of the preferences of an intending parent, how comfortable they are with the surrogate mother. It is totally legal to see the surrogate mother or know the surrogate mother because it is in agreement. It is legal to do surrogacy. Medical management, it is about two different components of surrogacy. When it is about, there are two ways. One is legal framework and other is clinical management. In clinical management, when we select a surrogate, we have to prepare her womb. We give her medication, prenatal vitamins. We have to prepare her nutritional status, her uterine condition, treat her for 1 or 2 months, keep her recruited, suppress her ovulation in the treatment month so that she doesn't have her own pregnancy during the treatment month, and then we go ahead for making the surrogate go for the embryo transfer. For embryo transfer, we have to do in vitro fertilization to make the embryo of the intending parents so that the egg and the sperm is fertilized and proper embryo formation is happened. Usually we go for blastocyst embryo transfer for surrogacy. Then what comes next is about understanding the legal framework of surrogacy. There are 3 parties involved in surrogacy. One is intending parent and the surrogate. Other is intending parent and the gamete bank and the ART clinic. And intending parent and the gamete bank, ART clinic and the surrogate. The legal framework must involve the gamete bank. According to Indian Council of Medical Research, involvement of gamete bank is essential for smoothness and transparency of the whole process of surrogacy. The surrogate mother's rights and her well-being also has to be taken care of when we are going for surrogacy. The compensation which we decide for a surrogate mother needs to be entered in the agreement and needs to be taken care of, that the surrogate mother is properly compensated for her services. Of course, we have to look at it as a humanly service the surrogate mother is doing, and we have to do her treatment as she's another patient, and we have to really respect the lady who is willing to carry a pregnancy of a couple who is a childless couple because of any medical complication whatsoever they can have in their reproductive lifespan.